Hello everyone, welcome to my YouTube channel. My name is Alona. So today is another learning day for viewers. First of all, I would like to thank the people who subscribe me, and if you're interested to subscribe me, you will be learning lots of information based on evidence-based research about pregnancy, breastfeeding, gardening, cooking, teaching, all in one. I'll be doing lots of videos, so before we start, please don't forget to subscribe so that you'll be able to follow all the videos that I'll be doing in my YouTube channel. Now today I want to continue my journey about pregnancy and breastfeeding. As usual, every week I'm making videos about common questions that mom wants to know about the pregnancy and about breastfeeding. So today I've written more questions, and I'm going to answer this question based on evidence-based research. And these questions came from many moms around the world who, because I've mentioned before, I'm a part of the breastfeeding group all over the world. So today we're gonna have fun answering questions, and you'll be learning about what's the best for your pregnancy if you're pregnant and for your breastfeeding. Now, this day I want to focus on prenatal and breastfeeding preparation. Now, the first question that I often read in breastfeeding groups is about preparation for the pandemic. If you're pregnant right now, what can you prepare for yourself that you'll be able to breastfeed when you gave birth? Now the question is, can you recall all the breastfeeding teachings if you attend a prenatal class? To be honest with you, as a prenatal instructor in the past, when I teach prenatal class, not all women, pregnant women who attended prenatal class with their husband or partner remembers everything that we taught as prenatal instructors. Why? Because in my experience as a lactation consultant and maternity nurse, most of the moms that gave birth, after they gave birth, they cannot remember what they learned during the prenatal class. So my best advice, if you're going to attend prenatal class, make sure you write all the important information that you need to know about yourself, your pregnancy, and your baby, especially with breastfeeding. And if you have a partner with you when you attend prenatal teaching, your partner will be able to remind you or recall some of the information, because when you go through labor, your brain is just sometimes come out blank, that you cannot remember the things that you learned prior to birth. So it's important, write everything that you need to know. That's the most important thing for you, especially in terms of preparing your breastfeeding or taking care of your baby and yourself. So your partner or your husband will be able to remind you of some of the things, most important things that you need to know about prenatal. Now, during this pandemic, it may be so hard to attend prenatal class in actual face-to-face teaching, where people supposed to remember the most if they're hands-on teaching, that they'll be able to demonstrate. But because prenatal teaching probably gonna be online or virtual, so it may be hard for some moms to retain all this memory. So write it down and have a journal with you, okay, prior to you give birth, okay? Now, there are some questions that's very familiar for some of you. Another question is that, what are the issues that will help moms prepare for breastfeeding? So what are those main concerns or issues that will help you as a mother to prepare for breastfeeding? Guess what? This is what some moms, because they're so they're very preoccupied with all the things that they're doing at home for the baby, for the baby, for the baby, for the baby, always for the baby. Take note, if you feel hungry, you need to eat. If you feel thirsty, you need to drink. If you feel sleepy and the baby sleeps, you need to rest, you need to sleep, because it's not just baby, 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 baby all the time. You need to take care of yourself, to prepare yourself for breastfeeding. And not just that, this is what I advise to some moms when I do home visits, because there were times in my home visit that I can see the husband is feeling neglected, because just the way how the mom is talking about just the baby, just the baby. How about the husband? So again, I've mentioned before, breastfeeding is a teamwork. There's always the third hand that can help you, your husband, or the second hand, sorry, your husband. So if you're feeling very tired and you just want to have a little nap or sleep, and you have stored milk right there, your husband can feed your baby. So you need to prepare yourself. If you're hungry and you're not, or too tired to eat, to cook because of your pregnancy or because you're breastfeeding, it's okay to ask a favor from your husband. And you know what? When you ask help from them, they feel like they are needed and they're not being ignored. So it's good. Ask for help whenever you need it, okay? Next question. When is the time you learn more about your baby? So when is the time that you learn more about your baby? This is about after 2 weeks, when the breastfeeding is established. This is the time that you're learning the feeding routine, your baby's behavior, your milk supply. Everything that you want to know about your baby's behavior will show up within that 2 weeks period. So if you're just breastfeeding for first week right now, you still have a long ways to know about your baby. And you know what? Some babies will adapt right away into breastfeeding. Even after, I've seen some babies, in my experience, after birth, because as a lactation consultant, I'm there all the time, right away, when the moms give birth. I can see the baby latch right away without any problem at all, like a pro. So it varies. Some babies are easily adapt right away to the breastfeeding mood, and others are just not doing good. And it's just like, here's the analogy that I can explain to you. In breastfeeding, there's no such thing as, for my experience, as the perfect, instant perfect breastfeeding for right then, first day, second day. Breastfeeding is like you're learning how to dance. When you want to learn how to dance and you don't even know the music, you don't even know the steps of the music, and you're trying to move your feet or your hands and you look so awkward. That's how breastfeeding is. Breastfeeding, for the first time, mothers, is awkward. It's hard. It's difficult. It's challenging. Just like learning how to dance a new step. So for some of you who are new moms or new to this breastfeeding journey, it's probably gonna take you a while. Maybe not for the first month, maybe not for the second month. Because again, breastfeeding is not easy for most mothers. There are some lucky ones who can breastfeed so perfectly right away. But believe me, in my experience, with myself and with my patients, breastfeeding is not easy. It's like dancing in a wrong tune of music. That's how I describe it when I teach breastfeeding. Okay. Next question. What's the best way to prepare your breast, or what's the best way for breast care? Well, if you are pregnant right now, or if you're breastfeeding right now and you still struggle with your latch because you have inverted nipple or flat nipple, there's still time to prepare for that, and it's still gonna improve, because again, the breast, the nipple and the skin of our nipple is elastic, so you can still do the so-called pinch hold when you pinch it, but make it gently, okay? So when you pinch it, just pinch and side to side, pull side to side, gently pull side to side. Do this one 3 or 5 times a day, or when you're taking a shower, or even when you're laying in bed. That will exercise and make your nipple elastic, okay? That's how you prepare it. When you're pregnant, there's some changes in your breast, the nipple area and the areola. So this area, areola and the nipple, starting to get darker in color and more elastic. And it's the skin stretches because again your breast changes its size when you're pregnant. And another thing that changes is you'll maybe find some lubrication around your, call it Montgomery glands, that little dots that you see around your areola. It's called Montgomery glands. You may see a little bit of secretions in there. It's your colostrum that moisten your skin in your breast so that it won't be flaky or dry. So those are the changes of your breast, and you can clean it just the way how you clean soap and water. Nothing specific that you need to do for cleaning, okay? So if you have flat or inverted nipple, how are you gonna prepare it? So as what I demonstrated, the nipple exercise, you can do that. Some moms, if you can afford, I don't know if this is available in Asia. Some moms, 2 weeks or 3 weeks before they gave birth, they wear a nipple shell. It's called a breast shell. It helps to protrude the nipple. If you have inverted or flat nipple, that's another thing. Some moms would use inverted syringe to pull it. Based on research, it's not advisable to use that because it may injure the skin of your breast or your tissue, your nipple. So it's very important to just do the pinch test or massaging it to make sure to protrude your nipple. But using the syringe is not anymore advised, even in the hospitals where I work, because it can damage or maybe traumatize the tissue of your nipple. Now, my last question, is colostrum leaking during pregnancy an indicator of abundant milk supply? So if you're pregnant right now and you're leaking your colostrum, does that mean that you're gonna have lots of milk in the future? The answer is no. Okay, there are some moms that during pregnancy they're leaking and pouring colostrum, but after maybe 2 weeks, 3 weeks, they have low milk supply. It happened to some of my patients in our breastfeeding clinic. Now, my best advice, if you have lots of colostrum right now and you're pregnant, collect it, freeze it, and when you go give birth, make sure you sign a consent. Ask your doctor that you're going to sign a consent that you're going to use that frozen colostrum to feed the baby after you give birth. So that's it for today. Thank you for listening. Please don't forget to subscribe and like the button. I will have another session for breastfeeding, pregnancy, children teaching, anything goes. So please follow me and don't forget to subscribe. Again, thank you for watching today and have a really nice day.